There are 2.5 million people living with a cancer diagnosis in the UK today, and that number is set to grow. So we know sometime between now and 2030 that number will hit 4 million. That's a massive, massive challenge for the National Health Service and for organisations like Macmillan. And we really need to make sure that we are geared up to be able to support the patients in the way they need support when that happens.
I had 18 months of treatment, and when you get to the end of that 18 months treatment, everybody around you thinks, oh, you're better. But in actual fact, that's just the start of it, really.
The National Cancer Survivorship Initiative was a partnership between Macmillan, the Department of Health and NHS England, and it ran from 2008 to 2013. And the aim of the National Cancer Survivorship Initiative was really to look at what happens to patients when they go through treatment and live beyond what we call survivorship. And out of this was born the Recovery Package. The Recovery Package has 4 components. The first one is assessment and care planning.
Holistic needs assessment is a way of assessing a patient at various different points during their cancer journey, not just to look at the physical issues that they might be facing, but also to see what elements of emotional distress may be playing a part. So it's basically looking at the whole person, not just their cancer.
Because this is a parent, we're going to look at the feedback on how you...
It's not always just cancer problems, it's things that affect your work or your family life or your relationships with your friends.
We're finding that it's making consultations really very focused and effective because we can very quickly drill down onto the areas that are of greatest concern to our patients.
The clinician who's carried out the assessment with the patient will come up with a care plan, which is basically a list of actions to see if we can address some of the issues that have come up in the assessment.
You're welcome. Good to see you again. The second part of the Recovery Package is a treatment summary. And this is just making sure that there's communication between the hospital, the GP and the patient, so that everybody is aware of what has happened during treatment.
For other healthcare professionals that may not be in direct contact with that patient, it gives them the opportunity to have an understanding and an awareness from a medical perspective as to what that patient's been through.
What it does do is encourages the consultant to say, well, the treatment's finished, I would advise that you do this and this. There are risks that the disease might come back, and this is what you should do about it. And these are the signs you should look for. And also, these are the contact numbers you may need. So they get my contact number for a start. So it's a really good thing to do.
It's very easy for people to feel quite dropped at the end of their treatment. Sometimes that's the time when they come back to us as their GP to talk about things. And if we've got a treatment summary, then it means that we can have a much more useful review with the patient at that time.
The third part of the Recovery Package is the Cancer Care Review. And this is a conversation between the GP and the patient. So we can make sure that the patient fully understands everything that's been going on and have discussed the needs that they might have, so that if they have needs going forwards, something can be done and they can be picked up on.
How are you doing?
Fine, thank you.
Not too tired? Having a structured template for the Cancer Care Review prompts us to think about questions that GPs don't always think about. When we first see our patients, we tend to be very medical, but in fact for people affected by cancer, they often have very different needs and priorities that they want to talk about. Having a template that prompts us to ask about simple things about their understanding of their condition and their treatment to date, finance and benefits, checking whether they've been involved with other health professionals and referred to an OT or a physio or other people who may be helpful to them is really beneficial.
The fourth part of the Recovery Package is a health and wellbeing event, which locally may be known as an education event or a health and wellbeing clinic. This is a group event that happens at the end of treatment, where people can get essential information and support from clinical specialists, local providers and other subject experts. It's also where the patient can start to learn how to take control of their lives and do things around talking about exercise and healthy lifestyle issues, which will really help them going forwards.
We have a marketplace of various cancer charities, providers and health information services to provide, in a very informal atmosphere, information for patients about the services they provide, about living well and living healthily, but done in an environment that is non-clinical, unthreatening, informal, and for patients to be surrounded by peer groups.
The Living Well and health and wellbeing clinics that we run give patients the opportunity to highlight problems with a clinical nurse specialist at that time, and we can also again then signpost them out from that day to other services if needs be, i.e. the dietitian clinic, the exercise clinics.
I went along to the Living with Cancer group sessions and they were amazingly helpful. Different speaker every week. Could be the practical aspects of living with cancer, perhaps some physiotherapy to help people relax, chance to meet other people in the same boat, different forms of cancer, but all wanting to get on with life. So it was immensely helpful.
Our role at Macmillan, now that the recovery package is truly developed, is to make sure that it gets rolled out as far and wide as possible throughout the United Kingdom. I said at the beginning there were 2.5 million people living with cancer. I want every one of those people to have had access to the recovery package. That is the only way that we can make sure that services going forward are truly person-centred.